get started. Good afternoon, everybody. My name is Kathy Hall. I am the Executive Director of the Nebraska Statewide Independent Living Council. First, I want to thank you all for coming. We're going to get some really good information, I think. I hope. Anyway, I also want to acknowledge Melanie Davis from the University Center for Excellence in Developmental Disabilities. She'll be working with me in the background to make sure we try to get this thing to run smoothly. These sessions have been put together by what is known as the Nebraska Disability Advocates. This is a group that includes 22 different disability organizations in Nebraska. I have a few housekeeping rules. Melanie is going to put the Dropbox into the chat box for everybody so they can access all the presentations. There is also a list of keystrokes for people to use for Zoom if they need it. Depending on the device you're using, the toolbar could be at the top or the bottom of the screen. Unfortunately, we only have one interpreter today. Hopefully, they'll be able to get somebody else, so we might have to take a break or whatever as this is going on. But I really would like to thank her for showing up. These sessions are also closed captioned, and to access that on your toolbar, there should be a little CC button. Beside that, there's an arrow pointing up. Press the arrow, and one of the choices it gives you is enable subtitles. And so then you can see the captioning. If you have any questions for the presenter, you can put them in the Q&A box, but please feel free to use the chat to have conversations. I think that's really important. We will be recording this presentation like all of the presentations we've done, and they will be posted on a YouTube channel. And Melanie is supposedly going to put that email, that web address in the chat box. I would like to turn this over to Tobias, who will be moderating today's session. I'm out of here.
Thank you, Kathy. Well, good afternoon, everybody. Kathy's hopeful this will be good information. I am much more confident because we have three excellent presenters today. Mel put in the chat box, if you have any questions, please put it in the Q&A, which is a little button on the bottom rightish corner of your screen. We've allowed time at the end of the presentations to answer any questions. So if questions come up as the presenters are speaking, please put them in there and we will get back to it. Three presenters today. We have Meghan Walls, the President and CEO of ASSISTology. We have Angie Ransom from the Assistive Technology Partnership. And we have Michael Elskin from Disability Rights Nebraska. So Meghan will be talking about, and they'll go into much more detail, but she'll be talking about what is assistive technology and what's an assessment look like. Angie will be covering funding and how to find money to pay for assistive technology. And Michael will be going over some of the laws surrounding assistive technology in the state of Nebraska. So I will turn it over to Ms. Meghan Walls from ASSISTology and let her begin her presentation. Thank you.
Awesome. Thank you everyone who's attending. And this is fun for me because talking about assistive technology is one of my favorite things to talk about. So let me share my screen and get us all set up. All right. So as Tobias mentioned, I am here to talk about assistive technology, kind of what it is and how that assessment process looks like. So ultimately, assistive technology is just anything that makes it easier for you to complete a task in your day or makes it easier for you to engage in general activities in your daily life. I posted this morning that I've added blue light blocker glasses to my daily routine to reduce my migraines. And so that's my daily assistive technology on top of smart speakers and several other things. So there's a lot out there that you're using already that you may not even realize is technically assistive technology. But there are a few different categories of assistive technology which impacts the path to obtaining them and funding, which Angie will talk more about later. But the durable medical equipment is one category. The non-medically necessary, which focuses more on that independence, quality of life, daily engagement in activities is another category. And then there's educational and vocational technology or assistive technology that's applied in educational or vocational settings, specifically for school or work. So it's kind of the overarching picture of what categories assistive technology could be in. Quick snapshot of some things that fall under that durable medical equipment category. Those will be things that are significantly tied to medical tasks or medical needs in your days, whether that be an insulin pump, a CPAP machine, mobility equipment, communication. These are items that are going to be recommended and worked, the specifics worked through with a therapy professional, speech, physical, or occupational, sometimes your doctor as well, and they'll help work with insurance to get these items covered. So durable medical equipment is the category that's most often funded through an insurance portal. Non-medically necessary, these are things that are not supported by insurance, but they do have a benefit to your participation in activities, but those activities aren't medical in nature. So they really can be academic, vocational, quality of life, independence, kind of all can fall in this category. Some examples, we're not going to cover all of these, and if there's a specific one you want to know about, throw it in the Q&A, or you can contact me later. But these are, there's technology for life, things that you just do in your normal day. You need to enhance your independence or ability to do tasks, or see buttons on the phone, or brush your teeth with a little bit more autonomy. There's a lot that can be done in the kitchen and around nutritional independence. Nutritional independence can be a maker or breaker for ongoing independence in living and within your environment. So there are a lot of things that can be used to increase safety or accessibility of different types of cooking or eating experiences, activities. I mean, almost anything can be classified as self-care, but these are just a few examples of some of those more self-care, maybe hygiene-related tasks, medication management, that there are adapted technology, assistive technology options out there that really just help increase that level of dignity in some of those tasks that you just really don't want someone else to be helping you with. There is so much that can be done through home automation. I like to say that Amazon had absolutely no idea what they were creating when the first Echo devices came to the market. The smart speaker and voice controlled, even switch controlled things in your environment that can be controlled using these systems from TV and lights and thermostat and ordering and phone calls really have made a difference in the level of independence for a lot of people in the disability community. And everybody, they're integrated in just about every aspect of our community, and in homes. We use a variety of them in our community, and I'm pretty sure my kids now think that they should be able to tell anything what to do by just giving it a command, and they're 4 and 7. So not that, my point is not that difficult to learn to use once you've got it set up. Staying connected, especially as we've learned in this last year, is monumental for work, for school, for mental health, and there's just a lot of simple ways that can be integrated for all levels of communication needs, abilities, supported options for simplified technology platforms, larger print, and video and phone as well. There's a lot for recreation, whether you want to play board games, you have a hobby like sewing or painting, playing music, gardening and getting outdoors. There are a lot of options out there, just depending on what your interests are and what barriers that you may be looking at that can increase your ability to connect with the community and socialize and pursue an existing hobby that your abilities may have changed and are impacting, or try a new hobby, find something new to engage in. Mobility and safety, these are just a few kind of simple things that can be adapted in the environment. The lift, the ceiling track obviously isn't simple. That's definitely a more technology-based one. But there are some simple things that can be done to help maintain safety and mobility in the environment if there's a concern that it may be changing, or stay ahead of any potential safety hazards from cooking, tripping, falling in the bathroom, stairs. Lots of different options exist for this goal as well. And then there's vocational and academic, from visuals, apps, and different talking technologies and magnification, lots of things that can enhance those in those settings and for those goals as well. And then let's talk about how assistive technology is, because there's a lot of misnomers that because it has the word technology in it, it's difficult to use, or it's electronic, or it needs programming. So there are things that are no tech. And sometimes that's just policy, procedure, or something visual in the environment, but there's no technology and there's really no moving parts. Very simple, easy to use. Low tech really doesn't take any training to use, usually less expensive than most other options. And it may have some moving parts like a lever or a knob, but not a lot of different features that need to be adjusted, and no batteries or electronics. That mid-tech may take a little bit longer to learn. It may cost a little more, likely going to have batteries, but not a lot of complex features. And then high-tech is where you're going to get into the things that are more expensive, take more time to learn, may require some training, are more complicated to set up perhaps, but still not unfeasible for someone to learn with the right guidance. So I know that was a really fast overview, but I just don't have as much time as it could take to go into detail on all of those. So what does the assessment process look like? An assessment is really just an active, interactive process where we're looking at barriers and solutions and trying to together as a team determine what makes the most sense for the goals that the individual has. So the outcome of a goal, or the outcome of an assessment, is to be able to recommend assistive technology that meets the needs, is consistent with the individual's skills, and ultimately helps them accomplish the particular tasks or functions that that they want to do, that give their days meaning, give their enhance their quality of life or functional tasks. It's kind of a 4-step process. So the initial step is just getting the referral in and connecting with the family individuals and the members of their team. Then we do the assessment. Then once we've determined the appropriate assistive technology and we find a way to get it, we implement it, and then there's a follow-up process to make sure it's really meeting the needs the way that we expected. And there's the reason for a structured approach is it helps ensure that we get the best match, and it reduces the chance or the likelihood of abandonment of assistive technology. An example of how this might happen is, or this process may go, is if you utilize the Nebraska Medicaid Comprehensive Day or Adult Day DD waiver, you can talk to your service coordinator about a referral for an environmental modification assessment. That's a service that I, with ASSISTology, am approved to provide, and it allows for an assessment in a home environment to look at barriers to independence and make recommendations about changes to the environment and assistive technology that may help remove those barriers and progress those goals to independence, and then support, further independence in other areas. So it starts with the referral through your service coordinator, and then we move forward in the process from there. Going through that process, once we're doing the assessment, it's really looking at that needs assessment. What do we want to accomplish? Looking at solutions, trialing items and options if necessary, getting them purchased and getting those implemented. When we're doing that needs assessment, we're talking about medical diagnoses. We're setting goals and expectations. We're identifying the barriers that are preventing those goals from being accomplished. And then a kind of the key element is making sure we're clear on an individual's motivators and their dislikes, because I may think that we have a perfect solution in mind, but the individual is 1000% not motivated, or actually like really turned off and dislikes something about the engagement. Well, then it's not going to be a good solution and it's not going to work. And then when you're looking at assessing solutions, there are some key elements to being innovative and creative into what that match is. It may not be in a catalog. We do try to utilize things that are commercially available, and we're focusing on the barrier that we're trying to remove, but we also may be using things in a manner other than what their intended use on market was. And a couple of those examples are on the screen. The one I will talk about is the pot with the green and gray strainer. So it's marketed as a portion control basket, but it's set up, it's marketed as a portion control basket in like nutritional dietary catalogs. But it's a strainer that sits on the edge of a pot. So for someone with reduced strength, reduced dexterity, who needs to do kitchen and cooking tasks one-handed, it allows to cook and strain vegetables, pasta, potatoes, anything that you'd want to boil in the pot and strain it there. So it improves some of that safety measures and increases some of the independence, but it's not what it was intentionally used or marketed for. So being able to kind of be creative and think through some of those things is really important as well. Then we can trial things. ATP has some assistive technology lending. There's atforall.com as a web-based catalog of assistive technology that can be borrowed and sometimes purchased. And then there are Tech Tools lending libraries that are sponsored by UCP of Nebraska in several locations around the city, even around the state. I host one down at the Metro Community College Fort Omaha campus. Inventories are online. Then you have purchasing and implementing. So purchasing, we'll talk about more in depth with Angie, but there are different funding streams for medically necessary and non-medically necessary, with medically necessary being really the portal or the category that is accessible by insurance. You have to get a little creative with some of the other options. This is my contact information, email, phone, and website. Happy to provide that and answer any questions today or as follow-up from the presentation as well. So that is what I have.
Thank you very much, Meghan. Katura, do you need a break?
No, I'm good for now. We can go through another presentation. Thank you.
Okay, you're welcome. All right, well, thank you, Meghan. And next up, we have Angie Ransom, the resource specialist with the Assistive Technology Partnership. So Angie, take it away.
All right, thank you, Tobias. I appreciate being here and being able to talk about funding coordination with the Assistive Technology Partnership. I'm going to share my screen here, talking a little bit about funding coordination and how we work together with the programs across the state. Okay, funding coordination. With the Assistive Technology Partnership, our offices are located statewide. We have offices in Lincoln, Omaha, Scottsbluff, Columbus, Kearney, and our education program, which is housed out of COZAD. It was really nice to follow Meghan's presentation because she did a fantastic job of explaining technology, low tech, high tech. And so a lot of the information that I'll share about finding funding coordination will really tie into understanding that there's a lot of possibilities for funding and how we can get creative, as she mentioned, in finding resources. Funding coordination through ATP is a really integral part to most services that we offer. And so I'll highlight some of the key parts that we do specifically regarding our service and device application. So ATP funding coordination connects Nebraskans with funding options for assistive technology. And those items for technology can be large or small. I liked Meghan's example talking about the blue blocker glasses to be able to use. Many of us sit for hours and hours looking at computers. And so that's an example of low tech assistive technology. The photos that are here are some larger technology. One can be a vertical platform lift to be able to assist someone in getting safely in and out of their home for independence. So what is this service and device application? I often find myself in my daily tasks talking to individuals who call in for questions or talking to agencies and tossing around the term service and device application. And so this is a great platform for us to be able to talk about what is that application? Who has the opportunity to fill it out? What do we do with it? And how can it help? So we'll talk about it being a multi-agency forum and how we identify programs for funding. We'll talk a little bit about collaborating with the applicant, finding out what assistive technology that they are looking for funding assistance with. And we'll also talk about the resource letter that they're provided to complete that process and continue to identify funding options. So the service and device application, what is the process? If someone is advised or recommended to call the Assistive Technology Partnership, they get a hold of one of our staff and we provide them with the service and device, often shortened as the S&D, the service and device application. It is on our website and it can be completed electronically or by a paper copy. All of the applications actually come into Lincoln for processing, so one person is able to look at those and case manage them when they come in and make sure that we're getting the right resources for them. It's individually reviewed for funding possibilities, and these can be loans, grants, or possibly referrals to other agencies. So when the service and device application comes in, we're going to take a look at a few things. First of all, what have they marked regarding their disability? And this is an important key to identifying resources because there are programs and agencies that are disability specific. So, for example, if the individual shares that they have been diagnosed with a specific disability or diagnosis, we're able to talk to them about the resources at a specific program. Maybe it's the ALS of the Heartland or the MS Society. We're also going to take a look and talk with them about what services and devices are you requesting? What would be helpful for you? What is keeping you from feeling independent and safe in your home? We're going to talk to them about program eligibility requirements. Some programs may have income requirements. They may have requirements on needing to be the homeowner, the age and miles on a vehicle, certain program requirements that are specific, again, to what they're requesting. And then we're also going to look at funding availability. Some programs and agencies have funding years and abilities to fund for a certain period of time. And so we're going to talk with them about what's available and connect them with that program if they have funding. So the second step with the service and device application is identifying when it comes in that we're making connections to potential resources that partner specifically with the Assistive Technology Partnership. And I'll talk more in depth about these, but some of them I wanted to highlight is Medicaid Waiver, Nebraska VR, and the United Cerebral Palsy of Nebraska. And the third step to the service and device application, once it's been completed, is that the applicant will get a copy of a resource letter. And this is going to be a letter that has information on other grants, loans, national programs, local programs that may have funding. And listed here, you'll see that we keep the application open for 90 days. And what that does is it just lets the individual and the family know that once they've completed the application, they're welcome to continue to call back in if they have questions, if they need follow-up or have gone to a website and need a little bit more information. Those 90 days, it doesn't mean that once the application comes in, they get the service device, or excuse me, the resource letter, that we're not going to continue to try to find resources for them. It's that time that they can call us and we can try to identify any additional or new funding. So as I mentioned, the service and device, the S&D, is a multi-agency form. And so some of the key players within our multi-agency partners and referrals is Medicaid Waiver. The Assistive Technology Partnership has a wonderful program coordinator. Her name is May Faith, and she oversees the Medicaid Waiver programs within the Assistive Technology Partnership. So for example, if a referral comes in from a service coordinator and funding is requested for that individual and they receive Medicaid waiver, whether it's the aged and disabled waiver or the developmentally disabled waiver, the DD waiver, then we're going to talk with a service coordinator about filling out that referral and having one of our staff work with them to do the assessments, work with the contractors, and find the best option for that individual in their home or in their vehicle. The other partner that we work very closely with is Nebraska VR. And when assistive technology is highlighted as a benefit to obtaining or maintaining employment, funding coordination can be provided to that individual and information can be given to them if they need to apply for services with Nebraska VR. We also have staff in our office who work specifically with Nebraska VR. So again, if equipment is needed for employment, we're going to make that connection and referral so they work with VR, Nebraska VR. And then Easter seals. I know Meghan mentioned that in her presentation before, I had it on a slide. And so it's a nice chance for me to be able to highlight that program as well. Easter Seals Nebraska is a wonderful alternative financing solution program that offers low interest loans for individuals for technology and devices. And on the screen here, I've highlighted out the 3 different programs that they have. The alternative finance loan, which can be a loan that the individual applies for between $2,000 and $35,000. The telework program, which is when equipment is necessary for work from home or employment. And then the mini loan, which is just a lower amount loan up to $19.99. An example of how we work with the Easter Seals Nebraska program is that someone may be eligible for modifications from another program, whether it's Medicaid Waiver, Nebraska VR, or other programs for modifications on a vehicle, but the actual cost of purchasing the vehicle is something that they're still needing. Working with Easter Seals Nebraska is a chance for them to apply for that funding so that they can see if they can find a loan to cover the cost of the vehicle, and then the modifications will be able to be put on. And the United Cerebral Palsy of Nebraska is another fantastic resource and partner that we work with. They provide limited grants for qualified individuals with disabilities. They assist with items such as adaptive equipment, removing barriers in the home. They have a client assistance grant. And UCP of Nebraska incorporates our service and device application into their packet. So we work quite a bit with them if the individual may be eligible for this grant. And lastly, I want to talk about the Reuse Network. This is a resource that really has become up and coming in the last couple of years. The Reuse Network connects individuals with equipment statewide. Examples of this can be wheelchairs, durable medical equipment, again, like Meghan mentioned in her presentation, crutches, bath chairs, hospital beds. These items are donated and we receive them, check them for safety, sanitation, make sure they're in good working condition, and then we can give them back out to those who need them statewide. We're seeing a lot of individuals that insurance may not be covering some of this equipment, or they just need it for a period of time. And so we're able to donate that to them. And that's my contact information. I look forward to any questions that you may have.
Thank you very much, Angie. And I see our other interpreters here, so we can continue right on. Next up, we have Michael Elskin from Disability Rights Nebraska, and he's going to talk a little bit about laws surrounding AT in the state of Nebraska. So Michael, I'll get your PowerPoint up here. All right, Michael, you should be good to go. Michael, we can't hear you.
Sorry about that. My name is Michael Elsken. I'm a staff attorney with Disability Rights Nebraska. I'm going to be talking real quickly about the law. There's a lot more to all aspects of the law than what I'm going to be able to cover in the very short period of time. Our agency has a series of what they call law in brief on various topics. And if you go to www.disabilityrightsnebraska, all one word, .org, and click on the resource tab, there's a little box in the top right-hand corner that allows you to check to resources. And if you go to legal resources, we have all sorts of law and brief materials. So if I race through this too fast for people, that's where you'd want to go. Next slide. Okay, assistive technology for individuals with disabilities, as differentiated from technology used by the general public, is really what I'm talking about when we talk about statutes and laws, and what protection exists really depends on the objective use of the assistive technology. There's not a universal provision which provides an absolute requirement that assistive technology be permitted. Instead, the legal provisions seek to promote the assistive technology while balancing the interests of other parties. For example, if a business has substantial security issues, they may not be able to allow an assistive technology device that allows a camera. So they may have to modify the assistive technology that you have use because of that security concern. Fundamentally, though, this means that assistive technology can be accessed while considering the burden upon the other party. Next slide. The biggest provision, statutory provision that people associate with disability is the Americans with Disabilities Act, or ADA. It is the principal disability protection statute under the federal law. It's not specifically designed to address assistive technology. What it reaches to is government environments, public accommodations, and employment. But assistive technology is used to implement access to the governmental environment, the public accommodations, and the employment, so that use of the assistive technology, again, is a balance. The reasonable accommodation doesn't mean all accommodations. Employers or entities have the right to assert defenses, which include undue hardship, fundamental alteration, and safety aspects. But the idea here is to provide the assistive technology as a mechanism to reach the objective of the ADA. It's not the objective itself. Next slide. The primary statutory provision regarding assistive technology on the federal level is the Federal Assistive Technology Act, and it's designed to provide a basis for the increase of access to, availability of, and funding for assistive technology for individuals with disability. In 2004, it was reauthorized to require that the state provide direct aid to individuals with disabilities to ensure that they have access to AT needs. However, there's a big caveat there, and the people from ATP fully understand this. This does not mean ATP has to provide the assistive technology to the individual for free. It does not require that they purchase the assistive technology. They can promote the direct aid by the various programs that they have, the funding for the lending of the equipment, setting up methodologies where you are able to obtain the equipment, the use of the equipment, and how that is done is really set by each state's individual ATP program. So a lot of what we just talked about, not we, but the prior people doing the presentations talked about is accessing that assistive technology. But I'm going to focus more on the legal aspects, and I'll get there once I'm finished with the various statutory provisions that are relevant. Next slide. There are a number of federal statutes provide some degree of federal protection that are not AT specific. The Rehab Act, that's how Voc Rehab, among other entities, provide access to certain assistive technology. It's designed to level the playing field for individuals who have disabilities, whether that be in schooling or employment or whatever. The IDEA, I'm not going to talk a lot about it. It's the primary act for protecting individuals with disabilities in primary and secondary education. The reason I'm not really going to discuss it is, according to the Tobias, you're going to be doing a presentation later on this year specifically focused on education. The Workforce Innovation and Opportunity Act, which is an omnibus employment statute, which is outside of the scope of just VR, talks about considering assistive technology for employment. And then the last one is the Every Student Succeed Act, which is the replacement for the No Child Left Behind Act. And it considers AT for meeting student needs in general. Next slide. There are a number of state provisions dealing with assistive technology. Nebraska Fair Employment Practices Act is similar to the ADA with respect to employment, but it can reach to employers who are not covered by the federal statute. Again, with the AT implications when you're talking about employment. The Nebraska special ed law and regulations implement the special ed requirements, including AT in primary and secondary schools. Technically, the state provisions can be more robust than the federal provisions, but the state of Nebraska has elected to basically mirror the requirements of the federal law. There are various rehab statutes available, including, and it needs to be emphasized, workers' compensation, which may allow funding of AT. Individuals who are injured at work and need assistance to be able to get back to the work environment, or just assistance in general, may be able to access funding for AT through workers' compensation. And probably the most important is the Nebraska Assistive Technology Lemon Law. And actually in the Dropbox, you will see the handout that our agency, their law and brief on the Lemon Law, originally hadn't planned on putting it in there because it was out of date, but we managed to get it updated so that we could submit it in your Dropbox. So people looking at the Dropbox will have access to that AT Lemon Law and brief, very detailed. It's like 3 pages long. It provides state protection for AT users who purchase or lease equipment. Next slide. The focus here in terms of the AT Lemon Law as it reaches assistive technology, which is new, leased or purchased, has to have an implication to a major life activity. Condition which constitutes nonconformity cannot be a result of abuse, misuse, or unauthorized modification, or which can be addressed by ordinary cleaning, maintenance, and care. To be able to make a claim under the Lemon Law, there you have to have at least 2 attempts to repair within a year of the purchase, and the nonconformity continues, or you submit it for a repair and it's not available for 30 consecutive days. So if you've got a power wheelchair that keeps on stopping for no reason at all, and we had a client that had this type of situation arise, you have the right to pursue an AT Lemon Law if you've done the 2 attempts to repair within the year, or the nonconformity results in not being able to use the AT device for 30 consecutive days. Allows to the replacement or return of the non-conforming device. So basically take the old chair, get a brand new chair. It doesn't have implications for the frequency of getting new chairs under the Medicaid or Medicare programs. And the information sheet is in your Dropbox. Next page. Obtaining assistive technology, and this was covered to some degree in the prior presentations, but there are a lot of ways that AT may be obtained, including the ones that we were discussed before. The more expensive the AT, the more important it is to be able to figure out how it's going to be paid for. AT can always be obtained by the individual with or without insurance reimbursement. Direct purchases can be made through regular earnings or savings or through specialized savings. And I'm going to talk about a couple of them that are real important. The ABLE account, right now you have to be have the disability arise before age 24, 26, 24, I think it is, to be able to sign up for an ABLE account. ABLE account shelters the money put aside. You can put up to $14,000 a year aside in an ABLE account. It doesn't count for SSI eligibility. They have been talking in Congress about increasing the age in terms of the onset of the disability up to age 46 or 49, which will make it much more feasible for individuals who develop conditions later in life. The other thing in terms of savings that are specific to employment is what's called a PASS program. It's a program to achieve self-sufficiency that's done through the Social Security Administration. The fact is, it allows you to save for and buy major ticket items. So that's one way to pay for that. AT may be obtained through programs paying for the AT. Again, you just had that discussed significantly, but there are other programs, including special education or voc rehab, where they can end up paying for it. And then the last, go ahead to the next slide. The last real thing is obtaining AT through insurance coverage. And you need to know whether the insurance is public or private. Private insurance includes things like insurance through employers or workers' comp. But most people don't realize that if you signed up for what's called a Medicare Advantage program, sometimes they're called all-inclusive programs or Part C plans. These are the things that Joe Namath is advertising on the television. That opts you out of the federal Medicaid program and into a private insurance program. So if you signed up for a Medicare Part C or a Medicare Advantage program, you're bound by the terms and conditions to be able to obtain the assistive technology as set by that program. What is covered needs to be considered by the language of that policy. So you need to talk with your insurer about the steps that you need to go through to get AT insurance paid for AT through that private insurance. Next page. Public insurance is basically, you're talking about traditional Medicare and Medicaid. Insurance coverage for an AT device under Medicare and Medicaid meet that category that are medically necessary. So first presenter talked about the different categories. your traditional Medicare and Medicaid insurance coverage. They're looking at whether or not the AT is medically necessary. There's a lot of AT out there that is nifty, but doesn't meet that medically necessary category. I went to an AT presentation last February down in Orlando, Florida. They had this device that would allow a person to feed themselves. It electronically allowed them to manipulate a spoon on a plate and pick up the food and feed themselves. That, at least at the time that I talked to the individual that was marketing that, that has not been approved as a medically necessary device. Great device, a lot of independence, but not necessarily medically necessary. Usually the larger the device is, the more expensive it is, requires pre-approval by Medicare or Medicaid. That's probably true in your private insurance too. Pre-approval normally requires submission by both a physician and a physical or occupational therapist. They want more than one person saying, yes, this is medically necessary. Medicare and Medicaid use the same standards for pre-approval, but those standards may be different and often are different than what your private insurance requires. And the real key there is do not actually order any AT which requires approval until it has actually been approved in writing. We've had people who come to us saying, but we were pre-approved, and they don't have the pre-approval in writing. So that can be a real problem. And I think that's the last page. So we're really to the point where we can start taking questions.
Awesome. Thank you, Michael. So we had a couple questions in the Q&A, and that was actually Meghan that answered that first one, not me. I don't know why it keeps throwing my name on everything, but because we had a couple, Meghan, would you mind talking about that a little bit? Like where do you get an assessment? What are the possible avenues to get one?
Yeah, so that's not an easy question to answer. It really depends on a lot of factors around what programs the individual is tied to, if it's a solution that they're looking to get that would qualify under medical necessity, if it should be paid for through voc rehab or work comp because of situations. I think the question that had come through was referring to the assessment that I mentioned through the DD waiver. So that one is available in an individual's budget. If it just has to be planned in, it's available. And so you work with your service coordinator for that one. And then there are different routes that they can map it. It looks like they could map it to me as an approved provider based on comments by someone I'm guessing is linked to ATP that showed up as anonymous. They can contact the person down in the ATP office, and it looks like, let's see, and then the follow-up was if the ADRC is able to assist. They may be able to provide you with a list of resources that comes through the NOAA office. So they'd be able to provide you with a list of resources, but they wouldn't connect you specifically. So and it may also come through a home health agency or therapist, depending on the situation. So the shortest answer is talk to whoever your primary, if it's a educator or workplace or service coordinator, or reach out to one of the agencies here that can try to help guide you. But it's going to depend a lot on the individual situation.
Thank you, Meghan. I had a comment here, wanted to know, so for environmental modification, so when ATP goes in, it is $1,000 for the out of the DD participants budget for us to go in and assess a mod. And I don't know what Meghan charges. It does differ between different providers. But I think the biggest thing to take away from this is know which programs you're connected to, because it always comes down to a funding source. So if you're working for Voc Rehab and AT could help you at work, that's when the referral comes to us. Or if you're on the waivers, there's a funding source. If you're in the school system, you know, the school may be required to provide AT. It's something that should be, or is required to be considered in any IEP or IFSP. So yeah, there's funding out there. Assessments, that's a tough one because you really need to have that funding source. But if there's not funding, then I would like if Angie wouldn't mind talking a little more about reuse, because the question did come up there. That's a no cost way to get your hands on AT. You might not have the one-on-one support by someone doing a full-blown assessment, but it's still a way to at least get your hands on equipment and maybe try some stuff before you do purchase. So Angie, if you wouldn't mind.
Yeah, no, thank you. And I'm glad that that question got brought up because I would have liked to elaborate that during my presentation. Reuse is not just made up of the Assistive Technology Partnership, it's a network. So we work with different agencies and groups and collaborate across the state. When someone receives a piece of reused equipment, it's at no charge to them, and they can keep it for as long as they need it. You know, if they want to give it back to us when they're done, that's fine, but oftentimes they'll keep that piece of equipment. I received a call a few months ago from an individual who just didn't qualify for any services to help modify his bathroom. And so we worked together for a long time trying to see if there were any resources. And ultimately, he was able to get a reused bath bench that worked for him currently, because he was in a situation where he needed just some safety in the shower, was able to get a bath bench that worked for him, and then continue to try to find some different funding through I believe it was with the VA. So even in a short term, trying to identify and find reused equipment for them, it can be temporary, long term, whatever they may need. It's really a nice partnership with the agencies that we work with, because we don't have a lot of storage space at ATP, and some of the other programs as well don't have storage space. But there are some partners we work with that do. So we'll get calls where individuals and families want to donate hospital beds that are in good working condition. And so we're able to coordinate with one of our reuse partners who has storage space through the hospitals, and we can go pick those items up and bring them to storage. We'll also do direct pickup and drop-offs. So for example, if someone calls and has a piece of equipment that they want to donate, we also have someone that needs that piece of equipment. We'll work together to coordinate so that they can pick up that equipment and take it directly to those who need it. It's just an evolving and fun part of our agency and what we do. And the equipment that we get is typically in really great condition. I would say that the only thing that really is something we have to look for funding for with reuse is batteries. So for example, we get calls where people may have power chairs that they've left in their garage, in their basement, and they haven't kept them plugged in. They're great power chairs, but they're no longer having batteries that work. So if we take the chair in, can we identify batteries or funding source for batteries? That tends to be one of the trickier parts, or very specific chairs that come in that were custom built for an individual that may not be suitable for anyone else that we have at that current time. So you know, that's one of the things that we work on, but reuse is just, like I said, in an evolving and very needed area. I know that we have gotten some calls with COVID-19 where individuals are maybe moving in with loved ones. And so they were needing some short-term needs like a transport wheelchair or a manual wheelchair, as well as getting calls for Pinnacle Bank here in Lincoln to bring wheelchairs to assist them with individuals for the vaccine. So word is getting out there, and if you have questions about reuse, certainly give us a call.
Thank you, Angie. We had one other question. Is the ADRC able to assist you in finding how to get an assessment? So ADRC is a great resource. They're going to point you in the direction of who you probably need to talk to. So if you're on, let's say, the DD waiver, the ADRC is going to know, go talk to your DD service coordinator. They might also point you towards ATP to fill out the service and device application. So the ADRCs are a good first stop for anybody. And then Michael, we had a question for you. Michael, could you talk a little bit about the difference between no student left behind, and every student
And then-
succeeds.
and seats. The primary difference is the way and the requirements of testing. They're going through the school system. It's not really a focus on the assistive technology aspect. And that's really a question that's probably best taken up for special ed presentation later on this year. But the primary difference between the two aspects is the testing and testing requirements for students.
Thank you, Michael. Is there any more questions? That's all I'm seeing in the queue right now. So a couple more minutes here if anybody has
Actually, in a way, I do have, I have a bit of a question, and that goes to, you can see a lot of assistive technology being marketed on eBay. I actually bought a replacement for the power unit for my wife's hospital bed on eBay. I don't know if there's a way to get financial assistance if you're purchasing through eBay, but that is a market there too. So just so you know that if you're running into problems, and there are a lot of families out there that, you know, they have grandma or grandpa who's passed away and they don't know what to do with that power wheelchair or that big ticket item, because the unit that replaced that I purchased, it's a $7,000 unit I bought for about $1,500 on eBay.
So
Michael,
I will say, sorry.
Go ahead. Go ahead.
To share a little story. So if you get a little bit savvy, because sometimes if you go through, say, like a vendor like Kohl's or Kubat's, they're limited in the brands that they can sell, and they might not have, if you're talking about like a walker or a Rollings walker, they might not have one that meets all of your needs. And if you find that one, say on Amazon or eBay, and you know that it's been pre-approved, you can purchase it in some cases and submit to your insurance company for reimbursement so that you get the one that you want and you're not limited to just what the vendor has to offer. So there are options like that as well. Not necessarily what Michael was saying about selling on eBay, but if you find something and you know that insurance has approved it, you could then make sure that you get what you need. You get the right match so that it meets your needs.
Thank you, Megan. I'll take a stab at this one too. And Angie, correct me please if I'm wrong, but if you get a grant, grants are pretty much oftentimes are written directly to the individual. So if you get some kind of a grant, they'll hand you the money, and then you can turn around and use that money to purchase on eBay. Or, and Angie, correct me here, the mini loan through Easter Seals. I'm thinking that also would be if you found an item on eBay and went through Easter Seals mini loan program, I want to say that they would then cut you a check that you could then turn around and purchase on Amazon or eBay. Is that sound right, Angie?
You could, yeah, I would definitely, refer to Holly Wodorsky with Easter Seals on the specifics of that, especially with eBay. But yeah, that's what the mini loan program is, anything up to $19.99.
Well, and with the UCP of Nebraska, the client assistance grant, the way that it's work, this kind of ties into some of that assessment stuff too, because as a partner in that program, if I'm working with an individual who qualifies for the grant under the criteria, we'll work together to determine what they need. And then the UCP of Nebraska, once they approve it, sends me the money. I get everything purchased and set up, and I build in training time into our ask so that I can help get the equipment to the person and set up to use it. So through that portal, you can access equipment through just about any vendor once you kind of know what you want.
All right, we have another question. How do you ensure that people are aware of the resources available to help acquire and fund AT? So first I'll say we do things like this, and ATP in general, we try to market and do awareness activities whenever possible. Now with COVID, that's been a little bit more difficult because we can't be at the statewide fair or statewide events or community events. But I believe all of us have websites that will also point towards resources. Angie, as the resource specialist, what else do we do to make sure people know how to get AT?
I think a big part is that service and device application, because it is a multi-agency application. So once that's brought in, the individual can mark any kind of assistive technology that they're looking for. So once that comes in, it's individually assessed, looked at, and then I give that individual a call. We talk about, I see you have listed here a ramp. Tell me a little bit more about that. Or I see here that you have an Amazon Alexa listed. How would that help you? Tell me more about it. We talk about agencies that are working with different programs. Sometimes they're starting fresh. This is new. Maybe they're newly, they've sustained an injury or have just received a diagnosis and are having some impairments. So we're starting from the beginning. Sometimes too, they've had a lot of experience with finding resources, but this is a new piece of equipment. So I think ultimately, to answer your question, the service and device application is a good starting point. If when it's received, I'm able to talk to them about some programs and make that warm handoff and referring them to those agencies, I'll happily do that. Sometimes too, it's working together and doing research. Back before COVID and we were working at home, I have a big map of Nebraska behind my desk because I'll get calls from all over the state where they're living in small counties that I may not be familiar with. And so I'll just start researching the county that they live in because that specific county may have resources that are different than Lincoln, Omaha, Kearney, some of the bigger populations. So it's really just an individual resource. And I encourage them to give me a call and we'll just talk about different funding options.
Thank you, Angie. All right. There's no more questions. We can give another minute or two, see if there's any last minute questions. And if not, then I believe we're almost finished.
Yeah. I have a few more things to say because, of course, I've got to be the last one to talk.
We just assumed that, Kathy.
Yeah, really.
All right, Kathy, I'll hand it over to you because I don't see more questions coming in, but I want to thank all of our presenters and everyone for coming in today. So thank you.
I really appreciate all the really good information we got, and I want to thank everybody for coming. And our next session will be on April 1st. So April Fool's Day. Get to spend it with us. And the topic will be the ADRC, Aging and Disability Resources 101. So it'll be an opportunity to learn more about what they actually do. And of course, it'll be 1 to 2:30 or whenever we get done. If you could think of a topic you would like to see us do, please feel free to reach out to me at Kathy, Kathy, at nesilc.org. And I will be glad to see if we can get that topic into the schedule. And so anyway, at this point, I'm just gonna thank you all. We'll just get done a few minutes early. And thank you to both of our interpreters. I'm glad they worked out. Everybody have a good day.